好，我们郭老师请下去。
好的，现在由我来隆重的介绍从美国明尼苏达州来的丁曙晴教授。丁曙晴教授呢，曾经在南京市中医院全国肛肠医疗中心做副主任及盆底中心的主任。我呢，可能有一些这个资料呢，大家可以看到哈。我呢想介绍一下我是怎么认识丁曙晴老师的。我在做我博士课题研究的时候呢，我要搜索一些关于八髎穴的文章，其中丁曙晴老师那个文章就出来很多他的论文呢，还有他的研究成果，和王玲玲老师的及其他老师的一些合作。所以说从那以后呢，我就认识了丁曙晴老师。等到再后来呢，通过王田俊老师呢，就是介绍他在英国中医联盟呢，英国中医论坛呢做了盆底疾病的一些这个讲座。今天呢是第2次我给丁曙晴老师做这个主持，希望呢我们继续合作愉快。丁曙晴老师呢，不只是在八髎穴研究方面有很深的造诣，现在呢他主要是也通过他的临床实践呢，他特别注重于中医针灸在盆底疾病中的整合作用，也极力在推广。在当地呢又得到了西医医生的很大的认可，也给他推荐了很多他们的病人。这一点呢，就是为丁曙晴老师感到骄傲和自豪。Okay, let me introduce Professor Ding. She is very famous the surgeon in China, non-remote American. Now she working there as an acupuncturist, and she has been dedicated to the integrated application of acupuncture in pelvic floor dysfunction. Also, she developing it quite a lot in the local area. She get many referral patients from local GP doctor and medical doctors. So we are so proud of her work in there, and now she going to talking about the detail of the clinical application of sacral neuromodulation by acupuncture in pelvic floor dysfunction. Welcome, Professional Dean.
Thank you. Thank you, everyone. I'm so honorable here and get the invitation from Dr. Wang, and also today I want to share some of my learning things from the sacral neuromodulation, because I also learned from Dr. Wang of the scalp acupuncture and Dr. Chen from the motion acupuncture a lot. Thank you. Why I'm entered this medicine? Because this is some story about how the acupuncture can get the very good results in this world. In 1998, when I'm in Nanjing, I just as a new practitioner in our colorectal surgeon area, I worked as a research for constipation. So at that time, I opened the research in this field. So 10 years later, I went to the US for our PhD, the post-PhD research, because at that time, I found the pelvic floor the disorder is MDT mode in Minneapolis in the US. So when I back to China, I start integrated pelvic health center in Nanjing University, in Nanjing Hospital, the affiliated teaching hospital in Nanjing University of Chinese Medicine. So at that center, we integrated the acupuncture, herbal medicine, biofeedback, and surgery together, and also a lot of radiology testing, manometry, EMG, so many things. So that's kind of the things we want to show how acupuncture in the real world, the integrated health, the background, it works. Then 2018, I moved to the US. At that time, I introduced this kind of the model, the integrative medicine, the acupuncture, into the integrated pelvic health area. So I have my own clinic. Okay, let's start. What is the pelvic floor dysfunction? So it's actually that's very popular the disorders, but it's a very undertreated area. There are 4 major dysfunctions. One is for the bowel function. So usually we will see patients have constipation, especially if they only have they have the sensation to go, but they have the incomplete sensation, so we call it obstructive defecation. And also we are very familiar with the irritable bowel syndrome for the constipation, diarrhea, pain, something, and also fecal incontinence. So these are all the bowel area. The second area is the urinary issues, frequency, urgency, nocturia, incontinence. The third area is the pelvic floor pain or pelvic pain. Then the sexual issues. So these are 4 dysfunctions in this area. And it's also very popular, but because of the privacy, and also that's a complex, so many patients, they are afraid to seeking the doctors to help. But actually when you see that, we will see not only the dysfunction, but also actually right now in the cancer, after the cancer operation, trauma, and the neurological disorders, there are so many dysfunction in the pelvic floor. So it's also not only for the female area, it's also for the male area. The third thing is why we think acupuncture is so important in this area, because all the symptoms, generally, it's overlapping. So it's not only focused on the one organ, it's systematic issues. So when we can see the patient at the same time may have the constipation and fecal incontinence. And also patient may have the fecal incontinence with the urinary incontinence. So these are all complex in the pelvic floor area. Also, patients have the mental health together. Also have the upper GI issues, and also many of from the elderly patients. So they have many medication, they have many chronic issues together. So these are for us, it's a very challenging area. How to use our skill to treat this kind of complex patients. So generally we see the symptoms. It's actually, this is only the visible symptoms, the tip of the iceberg. So it's when we see this area generally, if non-surgical area, it's usually the PT, the physical therapists, they will treat. But when they treat, if they are not very familiar with passengers, they will see this is the iceberg. We see this is the muscle issues, but actually it's related. The fascia, muscle, nerves, pelvic, spine, diet, lifestyle, and also it's a brain-gut axis, that's the network issues, like just now Dr. Wang mentioned the scan. It's actually very important for us to understand what is the pelvic floor issues. And also, this is topic for our acupuncturists and herbalists overseas. It's very important because more and more patients, they are seeking our help. They want to have some integrative acupuncture to help, non-pharmaceutical options to help. And also, when I see many of our refer patients, they already have the PT, already have so many medications, but they can't get the satisfactions. So that's our the gap we want to find. If we understand the pelvic floor issues more, we can expand our acupuncture clinical tool kits. So from my background, I'm a former cardiac surgeon. So for the integrative medicine field, also fits the psychological somatic root cause, and also it's a minimum invasive surgery. So I use my lens to understand how to use in our real world in the Western field. So when we can learn something about the background, how this technique promotes. Generally, why I in this field, because from the very beginning, when I'm in 1998, I know that that's a sacral nerve modulation. At that time, they called it sacral nerve stimulation, start in the clinical world. So that's actually from the Minneapolis. So that's why I choose there for my PhD research. And at that time, 2011, the FDA started to prove this device to be treat the fecal incontinence before they were treated for the OAB, for the urinary incontinence. But at that time, I found that's the way that implant sacral neuromodulation can be used as a tool to modulate the therapy. How can we do if we use the needles? So these are my start. Then I do the research, because when we see that this is the implant device, that's like a pacemaker. We have the electrode into the sacral volume, then with the pacemaker to do the stimulation. And also our acupuncture, our herbal medicine, how can we do that? Actually, acupuncture is the very cut-edge tool to do in this field. The features is very precise. We can do interactive and personalized. So from these two ways, we can understand that's the same goal. Use the tool to precisely modulate the neural regulation. Let's see a case from that. This is a 62-year-old male with stage 3 prostate cancer after radical prostate cannula. His major symptoms after the operation is a very severe urinary incontinence, ED, and ductorial. So, which makes him a very bad quality of life. So he come to see me because he has already got the PT, already got so many medications for that. And also he has already got the operation for his sciatic pain. So our acupuncture, the clinical focus is for the persistent post-operative pelvic floor dysfunction. We use the needles to help him from different ways. So acupuncture-based sacral neuromodulation was integrated into the post-operative rehabilitation field to restore the urinary and sexual function for him. And also, why I choose this patient, because I want to show that that's not only from the female. Okay, then I will give the demonstration about that. So this I speed up a little bit because that will save our time. Firstly, we will try to find the coccygeals, then we will try to find the S4 volume. The angle is very important, that's a 90 degree. That's a long needles, that's we call, I use a Fortune. That's a 90 degree. The degree is very important because we want to put the needles from the posterior volume to the anterior volume. We have to into the volume, that's the key. Then that's the degree is important. Then this is we're used for the pudendal nerve stimulation. First, we try to find the S4, then S4, S3, S2, and the pudendal nerves. Then we go to another side. The same. We find the S4 first, S3, 70 degree, S2, 50 degree around. Then that's the pudendal nerves. Okay, then we connect to the electrical stimulation. And also the most important thing, we have to ask the patient the sensation. It's better if we do for the fecal, we will let the sensation around the rectum area. If for the urinary, we will around the urethra area. Then add the scalp acupuncture, because that's generally patient will have the from the brain gut. Okay, so that's the whole key the technique. That's the 2 decades of my research. From the research to the clinical practice. This is right now we call the neuromodulation. We don't want to change the terminology or name, change that. But why we use that? Because we want to let more Western medicine doctor know what we are doing, use their language. This work actually very benefit from my mentor from Nanjing University, Dr. Ling Wang. It's also the mentor, Dr. Tianjin Wang's mentor, same mentor. Also, the work in my hospital, the Pelvic Center, we do a lot of research and published. So it's already there and now continuously refined through the international clinical practice now. So at that time, we use 3D CT to confirm the accurate needles placement through the sacral volume toward the sacral nerve targets. The accurate anatomic localization is the most important thing to effective this technique. So that's why Dr. Ling Wang do a lot of like research with us to guide us to be there. Okay, these are some indications. So right now we're not only for the constipation, but also for a lot of, okay, so these are some clinical evidence already published in JAMA and in Annals of Internal Medicine already there. That's two research, very important research is from Dr. Liu in Beijing. These are the research from Dr. Wang in Shanghai, that's pudendal nerves. So because of the timeline, I don't want to too more about the details, mechanisms. Okay, so these are another like demonstration about the 58 urinary and fecal incontinence after childbirth. Just want to show about the, you see 30 years the patient have this fecal incontinence. So I use the same technique, but also because this patient, just now that patient, he has a high tone of the pelvic floor muscle. This patient is a lower tone of the pelvic floor muscle. So I also use for increase the muscle tone. This demonstration I didn't speed up, so you can see a little bit clearer. That's the S3, then S2. Okay, this is S3. Then that's I use a pudendal nerves. That's the Hui Yang. That's Dr. Wang's technique. Dr. Wang Siyu. Then another technique that's from 支边 to 水刀. It's more focused on the levator muscle, more deep. So the patient will have the sensation around the target area. This is very important. Okay, that's it. So let's do like 4 message to take home. Firstly, we'll have to say pelvic floor dysfunction is a systematic issue, not only a single organ problem. Secondly, that's the acupuncture have the implant, non-implant, session-based pathway for the modulation. The third thing, acupuncture have more benefit from the 4 levels, not only for the 1 symptoms. The fourth is the patient selection, standardized technique, outcome, and a lot of like interdisciplinary research collaborations. We need more work. Thank you, everyone.
Thank you so much for Professor Ding's. Hello. Thank you so much for the Dr. Ding's the wonderful speech and share your wonderful experience. Anyone has more questions?
丁老师特别好，谢谢。我想问一下，就比如你那个针进去，就普通医生办针就行吗？
The size of the needles generally will use 0.30 and 75. That's 75 milliliters. 75. 3 寸。
那么就说这种针要进的比一般普通这样针进的多很多。
Yeah.
那么这个针就是你刚才接电针嘛？这个电针用持续波的用间断波？
That will be the continuously 2 hertz continuously for the generally 20 minutes for the stimulation.
一般要多长时间？
Generally 20 minutes for 1 session. The treatment sessions generally will be 6 to 12 sessions once a week. Thank you.
我最近正好就有这么一个那个。
Yes, please.
Research into other diagnoses of pelvic floor. Excuse me, would you allow me?
Yes, push it out.
In your research, have you looked at the prevalence of Ehlers-Danlos and the effects on pelvic girdle and organ prolapse? Because it's known to be multisystemic and linked to multiple organs like the pelvis, the intestine system, and prolapses, and whether the acupuncture techniques would work in the same way.
I can't catch you, but I think that's your.
他问那个脱肛什么之类的，也是使用者脱肛前。
Okay, yeah. So for the prolapse, actually there are 1 organ prolapse or other organ prolapse. Generally, if that's the internal prolapse, acupuncture works very well. And for the symptoms, it works very well. But if that's too much, if you have seen that's a prolapse already 3 degree to 4 degree, we have to do the operation. And also, if even do the operation, some of the patients still have the sensation, we can use, after the operation, we still can use the acupuncture. Thank you.
It's more to do with another condition called Ehlers-Danlos. It's a genetic condition that leads to organ prolapse.
然后遗传性那个器官整体各种情况下垂，一个遗传病那种从胸到都下垂。
If that's, yeah, I know that some of the patients, they have ESD, right? Yeah, so, yeah.
Ehlers-Danlos, yeah, EDS.
Yeah, so that kind of the patient, acupuncture not only for the sacral neuromodulation, but we may use other techniques and also with the herbal medicine together. Thank you.
One more question, last question.
Thank you for your lecture. Can I ask, when you do this research, do you ever see any bad effects or positive effects? If there are, what are?
You mean side effect?
What? Because side effects, bad effects. Because if people completely say, they can't pass in urine or can't control the bowel properly. But if you do that, you may completely worse or something never happened or not. Because this is a very important question. People will ask about the safety. Because I can see the needles. You are so big, so deep. It's very brutal. So people are very frightened. So you got to be ensure or assure people. And is there any side effects or bad effects? If there are, what is the how can you solve this bad effect?
Yeah, that's a very important question because generally we will use these needles, from the beginning, it's like 40 milliliter from the beginning, we do the research. Then we will have the standardized technique for 75 centimeters. But actually, the side effect is very minimal about some bruise.
So what just only the bruise, or can you make people completely incontinent?
No.
Never. Okay.
Yeah. And also, some of the patients, if they scared about the long needles, generally, it's not the first step for the first line technique for the patient, generally for the complex patients. So and also we need to do very better communication with the patient and absolutely consent informed. But the side effect actually for us, it's I think right now I show you that the long needles, it's generally according to the patient's figure, and also the sensation, and also when we put the needles in, we will see how to say, not to penetrate the organs, because we're seeing the electrode. They do the operation, the electrode, it's a similar. Yeah, thank you.
Thank you so much for the explanation.
Yeah, if any other question we can discuss later. Thank you.